Okay, so Jenny, we're at the end of, or coming to the end of the RAISE project trial. You've been the face of it for most of the sessions, and I'm just going to ask you a few questions, if I can.
Absolutely.
From a clinician's point of view today about how the trial's been, what's happened, what you've found. So we've got 4 questions.
Okay.
Is that okay?
Yep, that's fine.
Excellent. Okay. And the first question I do have to ask you, as we've asked all the way through this, do I have your permission to put this onto our YouTube clips?
You do, absolutely.
Thank you. So could you tell me what you think's worked well with the trials that we've done?
I think actually it's been very successful, from my opinion anyway. I think one of the successes has been the patient satisfaction. Patients have absolutely embraced the telehealth concept, and this is an older population who generally don't work with technology, and I thought that may have been a barrier, but in fact everybody who's been on the project has really enjoyed it. It's been great for access. Working in a GP surgery, it's sometimes very difficult to get an appointment, whereas these have been pre-booked, they've had access, they've had 20-minute appointments, which has been a bonus as well. So they've had the time basically to be able to discuss their problems. So not only has the physical condition been discussed, and we've also been able to address social problems, health promotion issues, as well as their mental health and emotional problems, which has been a holistic approach to looking at them.
Excellent. From a clinician's point of view, because I would guess that possibly there will be different clinicians watching this clip, is there any comment you could make about what difference it's made to you? Because obviously many clinicians are aware that you've got telephone triage. Has this made a difference? Have there been benefits to you in the practice by trying to use video consultation in addition to other methods?
Okay, again, yes, is the answer. Some of the patients who we've seen on this trial have had rashes, wounds, and with the actual complex equipment that we've had, we've been able to zoom in on the actual rashes and the wounds, been able to do an assessment of them and have them managed appropriately with the nurse who is at the other end of the video consultation, being able to manage those sort of cases. It's been also very effective. On the telephone you can talk to somebody, you can hear they're unwell, but you can't see them. Here you've been able to see how unwell they are, and with the visual concept has been very good to see how unwell they are, and this would particularly work well for in the future whether a GP needs to do a visit or not, because how somebody sounds on the phone necessarily isn't how ill they are, but actually having to see them is a really, really good way of looking at it.
Good point. And I suppose the last of the questions I'd ask is, can you see a future for this type of telehealth? We've done it as a pilot. Obviously we're going to submit our findings, but what as a clinician could you see there being a future for this?
I think this is an area which really needs to be explored. It has exceptional potential to be used in a variety of ways, definitely in general practice. We have lots of access problems, but also with an elderly population, a lot of elderly patients are at home and they have difficulty actually getting to surgeries because of transport issues, and particularly for our project we've had a lot of people living in rural areas. It would really help in that respect. I think it would also help with people who are in care homes, who are unable to access surgeries, and I think it can even be rolled out to people, for example cancer patients who are immunocompromised and their risk of infection of coming out of their homes and coming into an area such as general practice for a consultation. That would reduce the people like that. So I think there are many areas where it can work, and I think with careful planning it will be definitely something to look forward to in the future.
Excellent. Well, I must say at the end of this, there'll be a lot of people who would want me to say, because they would also want to pass this on to you, our thanks for taking part. It's been a real pleasure having you as the GP, and I know from the feedback we've had how many people who've used the service have really appreciated your way of approaching this, how the ease of which you've been able to talk to people, and we've had a lot of really, really positive feedback as well. So our thanks to yourselves and Martello Surgery for doing this, and thank you for taking part.
Thank you for those comments. I appreciate that. Thank you.